Hey everybody, this is Joshua, the tendonitis expert. And on this video, we're going to talk about why do you have chronic tendonitis. So let's start with the topic of what is chronic tendonitis. First off, chronic means long-term. And it implies that tendonitis is a short-term thing, but it's not. Tendonitis is long-term. There's no such thing as today you have tendonitis and tomorrow you don't. That's not how it works. So when your doctors tell you you have chronic tendonitis, what they're really just saying is that A, you've been hurting for longer than they think you should be, and B, they don't know how to fix you because they think it would have gone away already by now because they think tendonitis is just something that should just go away. And I'm telling you that that is not what tendonitis is, as we'll explain in a little bit here. So chronic tendonitis is a misnomer. Tendonitis is a long-term thing. Tendinitis is a dynamic. It's made up of multiple factors. And until you get rid of those factors, you will always have a tendinitis dynamic. Pain might come and go, but the factors at play will always be there. They don't just go away. So chronic tendinitis is a misnomer told to you by doctors who don't fully understand what tendinitis is, again, because they think tendinitis is something that should just go away. But that's not how tendinitis works. So I said that tendinitis was a dynamic made up of multiple factors. And there's three primary factors. Tightness of muscle and connective tissue, inflammation process, and nutritional insufficiency. These three factors all work together to cause pain and problem. Muscle and connective tissue get tight. Eventually, inflammation process kicks in, which releases chemicals which enhance your sensitivity to pain and make things hurt more, which tells your brain to make things more tight. And both tightness and inflammation eat up nutrition. So you already started lacking nutrition, which is a safe bet. And then over time, tightness and inflammation ate up even more nutrition. And you need that nutrition for your body to function. Again, these three factors, they all work together. If you get rid of some tightness with some massage and you feel better, within not too long a time, the inflammation process and the nutritional insufficiency is just going to create more tightness. That's why massage generally doesn't fix your problem, because it doesn't deal with all the factors. If you take an anti-inflammatory or get a corticosteroid injection, for instance, and it takes out some or all of the inflammation for a while, before too long, the tightness and the nutritional insufficiency will just create more inflammation. That's why you take anti-inflammatories and get injections, maybe feel better for a while, but the pain comes back. It's because tendinitis is made up of multiple factors, and to treat that, you must treat all of the factors. So when your doctor tells you you have chronic tendinitis, what he should be telling you is that you have multiple factors causing your pain and problem, and that those factors haven't been taken care of yet. But that's not what they say. They just say, well, rest for another month or two, or take some more anti-inflammatories, or go for some more PT. It didn't help before, but maybe it'll help now. That's generally their response, which again is just a function of they don't understand that tendinitis is made up of multiple factors. And those factors are what makes chronic tendinitis chronic. They're also what makes tendinitis tendinitis. So no matter how long you're hurting, whether it's for weeks or months, or hurt for months, you felt better for a while, then it came back, maybe in years or decades, because people suffer from tendinitis for years and decades when they don't know how to fix it, then the tendinitis is just something that you have to effectively deal with. What makes chronic tendinitis chronic is that you didn't fix it earlier, or your doctor didn't fix it earlier, or your physical therapist didn't fix it earlier, or your massage therapist didn't fix it earlier. And it's not your fault that you're still hurting. You just haven't been given the right information and the right treatment modalities to make the pain go away by getting rid of the causes of tendinitis. Because you do not want to treat the symptoms, you want to treat the causes. We've already talked about why doctors can't fix chronic tendinitis. A, they don't understand it. B, they don't understand that there's multiple factors at play. And C, they don't prescribe the right tools to effectively get rid of the problem. One main misunderstanding they have is that if you walk in with pain right here on a tendon, maybe some tightness, maybe some pain here too, they're going to look at that and they're going to say, hey, you have a problem right there. You have a tendon problem. And then they're going to try to treat the symptoms of that, the pain, etc. the tight tendon, quote unquote tight tendon. But you don't have a problem right here. You have a problem from here to here. You have tightness. Remember, there's tightness, inflammation, and nutritional insufficiency. So these muscles are all tight. Tight, 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 tight. Some of them are going to be more tight than others. Some of them will be really tight, and some of them won't be that tight. But they're all going to be tight and or too tight. And when muscles are tight, they're pulling the tendons. And they're pulling the tendons that way. So tight muscles are constantly putting tension on the tendons. So when your doctor says, oh, you have tight tendons, what they should be saying is, oh, your muscles are tight. And then what they should say is, oh, we should relax your muscles. But they don't say that. They say, we should try to fix the pain here on the tendon because you have a tendon problem. Moral of the story here is, if you have pain and or tightness, it's an overall dynamic, and it's caused by tightness, inflammation, and nutritional insufficiency. Those three factors are what make tendinitis last over time. That's what makes it chronic. So how do you get rid of chronic tendinitis? The answer is the same way you get rid of regular tendinitis. Because again, regular tendinitis and chronic tendinitis are exactly the same thing. Just chronic means it's just lasted longer than your doctor thinks it should. Or maybe that you think it should. But how do you get rid of tendinitis? How do you get rid of chronic tendinitis? The simple answer is you get rid of the tightness, you get rid of the inflammation, and you get rid of the nutritional insufficiency. Here's a bucket, here's a bucket, here's a bucket. If you only do this much correction of the nutritional insufficiency and only do this much correction of the inflammation, and only do this much correction of the tendinitis, of the tightness, you're not going to get better. You might get a little better for a day or two or three, but it's all just come right back. If you completely get rid of the inflammation, that's great, except the nutritional insufficiency and the tightness are going to cause more inflammation, so it's going to come right back. So to get rid of tendinitis and or chronic tendinitis, you have to completely and effectively get rid of the tightness, completely and effectively get rid of the inflammation, and completely and effectively correct the nutritional insufficiency. That is how you fix and or get rid of tendinitis, whether it's chronic or whether you've only been hurting for a week or so. If you'd like to find out more about chronic tendinitis, go ahead and visit my website, tendonitisexpert.com, and find the appropriate page. If you'd like a complete plan about how to get rid of your tendinitis, again, whether it's chronic or new, I recommend one of my reversing tendinitis programs. There's more than just these three, but depending on what you have going on, I provide a complete program that tells you exactly what you need to do to get rid of the tightness, to get rid of the inflammation, and to get rid of the nutritional insufficiency. And you can find that on my website as well.